Thank you all very much for coming. My name is Charles Kolb. I'm the president of the Committee for Economic Development, and on behalf of our staff and our trustees, I want to welcome you and thank you for coming. We are very pleased to be partnering this afternoon with the New America Foundation and also the Better Healthcare Together Coalition to sponsor a discussion on healthcare and healthcare reform. And we are very, very pleased that the focus of the discussion today will be on a new report from the McKinsey Global Institute, Accounting for the Cost of U.S. Healthcare, a new look at why Americans spend more. And Lenny, I don't know, could I say spend more and get less in terms of the quality of the coverage. For CED and our partners, this will be an entire day devoted to healthcare. We started in the morning with a small discussion with two senators, Wyden and Whitehouse, about some of the ideas we have on some of the things that they're doing, and then we had a discussion with some of the key congressional staff working on legislation. We had this presentation and discussion, panel discussion with your active participation, we hope. And then some of the CED trustees later this afternoon will meet with a small group of the transition team people working with Senator Daschle, soon to be Secretary Daschle. So it's been an entire day focused on healthcare reform, and we are honored that you could be here with us. It's now my privilege and honor to introduce Len Nichols, our partner in all of this work. And Len is the director of the Health Policy Program at the New America Foundation here in Washington. He is a health economist and a policy analyst. He has testified frequently before Congress and state legislators and has published extensively in many health-related journals on insurance coverage, financing, and delivery system issues. And most recently, Len has worked very closely with Senator Ron Wyden from Oregon on that senator's health reform legislation, which is now co-sponsored with the Republican senator from Utah, Bob Bennett, and I believe it's called the Healthy Americans Act. Before joining New America, Len Nichols was the vice president of the Center for Studying Health System Change, a principal research associate at the Urban Institute, and the senior advisor for health policy at the Office of Management and Budget during the early years of the Clinton healthcare reform efforts. And he had served as the chair of the economics department at Wellesley College, where he taught for 10 years. But most importantly, from our perspective, he is a wonderful partner, and we enjoy the relationship and look forward to many more opportunities. Len Nichols, thank you. Thanks.
Well, thanks, partner. I appreciate that. This is the beginning of a beautiful friendship and relationship, because I am so impressed with the way CED has led the nation in many issues, and now they've brought together Better Healthcare Together with us in this room, and we had so much fun this morning on the Hill. We're definitely coming back. I am particularly proud to be here this morning as a facilitator of Health CEOs for Health Reform, a coalition we've put together of healthcare leaders who we think represent a new voice in the health reform conversation. Now, this initiative is unique for lots of reasons, but mostly because each and every one of its members is willing to offer and to accept changes to their business models as part of a catalytic reform package that will enable our system to be sustainable and serve all of us. So I'd quickly like to just list the founding organizations here. We may grow it in a very controlled way a little bit over time, but I want to tell you who was willing to go in the first round. Billings Clinic, you'll hear from Nick Walter in a minute. Blue Shield of California, Catholic Healthcare West, Denver Health, and Patty Gabbo will also speak in a moment, Merck, and the Virginia Mason Medical Center. Now, over the coming months, this group, Health CEOs for Health Reform, will offer some thoughts about some solutions to some of the toughest questions in the health reform conversation. And I think what's unique about it is the willingness to work across sectors and reconcile the priorities of lawmakers with what will work in the real world. And these people were very carefully chosen because they are running successful organizations in today's healthcare system, and they know we need to transform even them, but also the system as a whole. Now, today's agenda for this whole meeting will address one of the truly fundamental flaws in our health system. Healthcare costs too much. You might have heard that rumor. And in many cases, we simply do not receive anywhere near enough value for the money we spend, and we look forward to learning from Lenny Mendonca and the McKinsey report once again. But I'm particularly excited about the coalition that we're bringing together here, because what we have here is a group of business, labor, and healthcare stakeholders who are willing to engage in order to align interest. I mean, think about the typical experience on Capitol Hill. Each group goes in one at a time and tells their congressman, here's what I want, here's what I could not stand. And then they go in sequence, and so the staffers and the congressmen are left with a fundamentally irreconcilable set of demands. Clearly what we need to do is align our interests, and indeed it is possible to do that, and to me the big link is payment reform, and you're going to get that only if the sectors talk to each other and then go in together, and that's what we're trying to do fundamentally. So thanks again for coming today. I'm extremely excited about this conversation in this year, and let me turn it over now to Better Healthcare Directors Director Jody Hoffman.
I wanted to welcome everyone here today. Thank you for coming. This has been just a terrific day, and we have heard from really some great expertise from the business community and the business perspective, the labor perspective, and from our think tank and really thoughtful economic research partners. It has been a terrific opportunity. And the response to this lunch has been just overwhelming, and we thank you for that. It goes to the heart of how much people do want to engage and come together. And in many ways, that is what Better Healthcare Together is about. We are a coalition of business and labor that came together in 2007. And I have the honor and privilege to introduce two founding members of Better Healthcare Together, one to give you the labor perspective and one the business perspective before the rest of the program continues. And our first speaker will be Mary Kay Henry. She is the Executive Vice President at the Service Employees International Union. Mary Kay Henry has devoted her life to helping America's healthcare workers form unions, improve their jobs and the quality of care, and advocate for a more rational and humane healthcare system. Since June of 2004, she has served as an international executive vice president of SEIU, leading the union's efforts to build a stronger voice for healthcare workers. Recognizing that today's global economy demands a new and different model of labor management relations, Mary Kay is leading a national effort by SEIU to build new kinds of partnerships with hospital employers, partnerships that will improve the quality of patient care, strengthen the hospital's competitive performance, and give workers a voice in decisions that affect care and working conditions. After Ms. Henry speaks, Linda Dillman, who is the Executive Vice President of Benefits and Risk Management at Walmart Stores Incorporated, will address the group. Linda is has assumed this leadership role at Walmart since 2006. With her leadership, Walmart has been recognized nationally for making innovative changes in its health care benefits, concentrating on providing associates and family members with affordable, accessible, and high-quality options for health care coverage. Ms. Dillman serves on the board of directors for the American Health Information Community Successor, the Robert Wood Johnson Foundation's Commission to Build a Healthier America, the Center for Disease Control and Prevention Advisory Committee, Arkansas Governor's Roundtable on Health Care. Ms. Dillman was named to Fortune's 50 Most Powerful Women in Business list in 2003, 2004, 2005, 2006, and 2007, and we are sure she will be there for 2008 as well. With that, I'm going to turn over the podium to Mary Kay Henry.